Hi, y'all. I'm Joe, your host and cannabis lifestyle guide. And I am sandwiched on this live stream between the two pharmacists that are going to give us their POV on CBD today. So I've got Jeff on, well, he looks like he's on my right, and Doug on the left. Gentlemen, they are the co founders of Farmer and Chemist. So, first and foremost, they're pharmacists. Second of all, they've got a killer CBD product line that we'll talk about later on in the show. But, gentlemen, thanks for joining us.
Thanks for having us.
Yeah, it's a pleasure to be here. Thank you.
Yeah, I this little setup when I put us all on the screen, I was like, "Oh, I haven't done this before, but it's kind of fun." Um, so I thought today it would be really great for us to go over just the common uses, what to know and consider before even going shopping for CBD. There are, the comorbidities and the potential adverse effects or drug interactions. I want to kind of touch on those things. And then I have a couple of listener questions that we'll tackle. So let's start with, what do we need to know before considering CBD?
Well, I guess I'll start. Then Doug, you can chime in. So we can come back and revisit the first part of that question. I think about what it's used for and maybe some of the science behind that, because I think that's super fascinating. But personally, I would say what people should be asking when they're contemplating using CBD is, first of all, who's it from? And then they need to be asking about, could it interact with other things I'm taking? What are the side effects? And then how to dose it and how to take it. So,
Yeah, I guess maybe I wanted to start with our why. So that is the
yeah,
common uses. So first of all, why do we want to take it?
So our bodies actually have two cannabinoid receptor systems. So we're built that way, right? So not to get all like druggy and geeky, but when we take drugs and medications, they bind to receptors in our body, and they're absorbed, and that is what effectuates what they're used for. So CBD actually binds the same way as drugs to these receptors located throughout our bodies, and these receptors are located centrally, so in the CNS. So that's where we get the mental health side of it, if you will, but also peripherally. And a good way to explain it is CBD is actually a very potent anti-inflammatory. So CBD has been legal since the Farm Bill in 2000. What was it? 2018. 2018. But it's been around for thousands of years. And so the science is catching up to how it's been used, but there's plenty of data and good scientific data showing that it's really good for pain. So all different types of pain. So, arthritis, but also nerve pain, different types of pain, but also anxiety and sleep. And then more anecdotal, but again, data is coming in on all kinds of other things, from migraines to cold sores to you name it. Because again, it's a very potent anti-inflammatory. So.
Yeah, I think what Jeff said is exactly right. The body has this endocannabinoid system, so it knows how to take cannabinoids orally or topically and do with them the right thing, which is relieve inflammation, de-stress someone by relieving anxiety, and help with sleep. It's really cool, actually, to think that our bodies have their own cannabinoid receptors. It's not like taking a narcotic or an opioid that goes in and grabs onto a receptor that it's not designed for. Instead, CBD goes into a very specific receptor. They're very cleverly called CB1 and CB2.
Yes.
So,
and imagine that nature would match up perfectly with our bodies.
Isn't that awesome? So now we finally have legal products in the U.S. That are effective at relieving all of those things: stress/anxiety, deprivation of sleep, and pain because of inflammation of many varieties, as Jeff said. That's totally natural, that fits with our bodies.
So, you two being pharmacists and you went to school, were you taught anything about the endocannabinoid system?
Zero.
Nothing.
Yeah.
In fact, when Jeff and I went to school, which was a long time ago, marijuana was completely illegal. It's a Schedule One. Well, it's still a Schedule One controlled substance. Um, and the only thing that I learned about was in our law class. I went to school in Chicago, and we talked about marijuana in law class. That was it.
Yeah. And I'll dovetail that and say, 20 years ago, when I was graduating from pharmacy school, pain was kind of the fifth vital sign, is what they called it, right? I mean, it was
Right.
throw opioids at pain, and you never wanted to undertreat it, and so we've seen a complete reversal of that because of the opioid epidemic, for lack of better description, and so we're learning that in some cases because it is natural and because it is doesn't have the same addiction potential and the side effect potential, it could be a good alternative to those very drugs that we've discovered over the last 20 years can be very detrimental to somebody's long-term well-being. And
Absolutely.
physicians, and I'll just say this too, also, we're pharmacists, same thing. I would say in medical school, unless you graduated within like the last 3 years, it's probably the same situation. You probably never heard about this. And unfortunately, physicians probably right now are seeing a lot of patients who are taking it and not telling them they're taking it, or are interested in taking it and they're asking their doctor about it, and the doctor doesn't have any background. So that's one of the things that Doug and I are focusing on and trying to kind of fill a gap in being a reference to physicians so that they can
Right.
feel more comfortable about what this is and how it's used and how to appropriately recommend it for their patients.
And what is that like right now in your community? Are you seeing people that are kind of being a little more stubborn about getting on board, or are they quickly seeing the value?
Yeah.
I think there are both. I think there are physicians and patients who are in both categories, but it's across the board age-wise. So there are young people that are nervous about using something that could make them addicted, like they've heard about with the opioids. But they're looking for relief, so they're curious. There are older people. I mean, Jeff and I are not young, older than us, that are coming in and asking about it, saying, "I never thought I would ask a question about cannabis or cannabinoids or CBD, but here I am." And they're more positive about it sometimes. So we've got the resistant folks as well as the
Yeah.
folks that are curious and engaging.
Well, and I'm talking about your peers, because I know that about consumers. I'm talking about your peers.
Probably the same answer, right? It's across the spectrum. I would say healthcare providers are probably anecdotally, for what it's worth, a little bit more resistant to this than, say, the general population, just because they've been trained in a different way, right? And so this again wasn't taught to them when they were in school. But as you've been doing this for a long time. I mean, that's part of the problem here. Is there's so much miseducation or lack of education about what CBD is, what it isn't. How does it compare to medical cannabis and all that kind of stuff. And so there's still a ton of misperceptions and a lack of education out there. And hopefully that improves.
Right. And that's why I always try to make sure that, as consumers, we
Yeah.
are super educated going into the doctor's office so that we have the information we need to defend our lifestyle and to help educate,
Yeah.
our doctors.
Yeah.
So, and that's the thing when I want my parents to take CBD, but they're on blood thinners.
Right.
And
Right.
so there's so many people that I know CBD could help, but they have these other issues, and I don't want to be responsible for them
Yep.
taking it without considering these things first. So
Yep.
let's talk about that, about the
Well, that's so important. So I'll just say, from a safety perspective, CBD is pretty safe. It doesn't have a lot of traditional side effects that you see with other medications. It's again not addictive like an opioid. If you take a ton of it, you're probably going to have be really tired. I mean, that's kind of what happens. But the bigger issue is just that it's the drug interactions. So we've talked about receptors and how CBD binds to receptors, and that's how it works. It's also metabolized or broken down by enzymes. And there are I think about 6 enzymes in our body that account for metabolizing about 90% of drugs. And CBD is metabolized the same way. So essentially, when you have CBD and some of these drugs, they're competing for these enzymes. And so it affects how they're broken down and metabolized. And so it could increase or decrease the amounts of these other drugs or CBD in your body, and therefore either increase the side effects or make the drugs not as effective. So
absolutely.
But you said it. I mean, the most common ones are anticoagulants, antiplatelets. So if somebody's taking warfarin, for example, we absolutely recommend that they, monitor their INRs. They're upfront with their doctor about it, so we can see what's happening with that. And because again,
what is an INR?
It's a lab test it's a lab test. When people are on warfarin, it's a lab test to make sure that they're clotting appropriately, essentially.
Okay.
But again, a common drugs, because this acts centrally, are the drugs that are used to treat the very things that CBD is used for. So anxiety, even antidepressants, other things. And so, again, one of the things we always say is, if you're comfortable, tell us what you're on, and we'll go through the individual side effects, but also make sure you talk to their doctor. But then going back to what we talked about earlier, if they're talking to their doctor and doctor doesn't know, then we haven't accomplished anything. So we're trying to close that loop too. Yeah, exactly.
Circle of insanity.
Yeah.
So, okay. If someone is on blood thinners, is the answer just like, sorry, you can't take CBD?
No.
Okay.
No, and it's really two. Yeah, sorry, Joe. It's 2 blood thinners that we're talking about really specifically: warfarin, which has the brand name Coumadin, and clopidogrel, which has the brand name Plavix. Those are the 2 that have the most significant drug interaction with CBD. There are other newer agents that someone might be taking for atrial fibrillation that don't have that same significant interaction, because, as Jeff said, they're metabolized by the body differently. So to answer your question, is it an absolute no? No, it's not. Now, if you ask us if you're just walking down the street and say, hey, I'm taking warfarin, can I take CBD? Our answer is going to be no, because we want people, as you were saying, to be really smart about this. And as Jeff was talking about, to talk to their doctor. But there are ways to safely use CBD and be on these products. And it comes down to dosing and the timing of each medication that the person is taking, and how quickly those drugs and the CBD are metabolized. It comes down to dosing and delivery method. So a tincture or a gel cap or a gummy of CBD is totally different from topical CBD, which someone who's using a blood thinner can absolutely use without any safety concerns.
Mm-hmm. So I guess then my directive to someone asking then would be, no, take the specific name of the blood thinner that you're taking and ask your pharmacist.
Absolutely.
Yeah, or even better, go to a CBD place that actually has pharmacists on staff, right? So
like
not for a little personal plug,
right?
But I mean, if you go, but similar to my doctor comment, if you go into a pharmacy, and we talked about a few minutes ago, we've learned about this because we're in this space. But a general pharmacist who's working in a chain store probably doesn't have the same background, and they probably don't know the answer to it. So
we're going to get comments about
it's
that.
Partly just partly is we want you to talk to a doctor and pharmacist, but the answer there really needs to be talk to a doctor or pharmacist who knows what they're talking about in CBD. And
Yes.
you definitely don't want to walk into a vape shop or something, or a convenience store and buy your CBD. So, yeah.
This is a true story. Okay. Well, but that's what I wanted to know is it's not a hell no. And that's what I basically, how I read it. If I'm doing homework online and you read that, it basically is like, oh, you're on a blood thinner. Sorry, CBD is not for you. And I knew that couldn't necessarily be 100% all the time.
Yeah. Like Doug said, there's different types of anticoagulants and antiplatelets. And so we need to talk through that. But as far as I know, there's nothing that's a flat out contraindication, which means you just should not use it. But again, it can potentiate or diminish, the effects of the drugs you're taking, and you do have to be careful and you have to adjust. So again, if you're taking an antidepressant and you're elderly, for example, you might want to, again, in consultation with your doctor, maybe slowly lower the dose of the antidepressant because the CBD is going to increase the concentration in your body. And if you do that, you're going to get more of the side effects that come with the antidepressant, which could be, could be significant if you're not careful. But it's not a flat out contraindication. You just need to be careful.
Got it.
Yeah, there are so many times that someone is prescribed a medication that does have, and then they're prescribed a second medication by their same physician, and there are contraindications to using both together.
Yeah.
But it's still the right thing to do. You think about those same blood thinners. On the label of those blood thinners, it says don't use with aspirin. But almost everybody who has cardiovascular disease who is using one of those blood thinners is also taking aspirin. So it's okay to use. It's okay to use if it's done wisely, as we've talked about.
Okay. So now let's talk about, the comorbidities piece. When, we're not talking about just some healthy wellness consumer, but someone who has other things going on. What is that thought process before introducing CBD into the wellness toolkit?
I think that's a really great question and key for a lot of the folks that come into our store and are probably listening to this podcast. I think the first thing as we think about with comorbidities, it's mental health or behavioral health types of issues. So whether that's anxiety or it's depression or it's bipolar disorder. And there are a lot of folks, as we know, who are using cannabis, self-treating, all kinds of mental health diagnoses. So that's question number one. What else is going on? How are you treating that? And is that treatment that you're using effective? And if it's effective and you're doing well, that's great. As pharmacists, it would be hard for us to discourage someone from stopping something and starting something different if it's working. But if it's not working, or it's insufficient, or you want to have a more natural product, then CBD can supplement what a patient is using, and may even allow the patient to reduce the dose of the prescription medication that they're using.
Jeff, do you want to add something?
I think that was a great answer, and I agree. I think just to follow on, I think it goes back to what we were talking about earlier. It's comorbidities are what else do you have? What other conditions do you have? What other medications are you on? And again, where does this fit? And what do you need to look out for? And how can you appropriately use it to maximize the benefit and avoid drug interactions and side effects? Yep.
All right. No nonsense answers here. All right.
We're pharmacists. We can't help it. We're just nerdy straight down the line.
I know. I don't mind. I'll add a little color in the middle.
Please.
All right. So I have a couple of questions from listeners who, they are both wellness consumers. And, one of them was, what is the right dosage for somebody just introducing it into a daily wellness regimen, because it's kind of expensive. So, if we're not trying to break the bank, what's the best option?
Yeah, well, I think it's important to note that the good stuff is expensive. And it goes back to a comment that you made earlier, and that's about where to get it and the potency of the product. So that's really key. If you're dropping into the convenience store and buying the cheapest CBD that's available, then in order to get an effective dose, you're probably going to have to use a lot of that product, because there's the potency is so little. So it's worth paying a little extra to get quality stuff. So I think that's number one.
Yeah, and so we spent a lot of time researching this. We work closely with our chemist who helps formulate our products. And what we've seen in the literature is that typically it's a 25 milligrams a day is what we call the minimally effective dose. And then then it depends a little bit on weight and other things. And so, if you're 150 pounds, your dose is probably going to be different than if you're 300 pounds. And if you're 85, it's probably going to be a little bit different dose than if you're 25. So these are all things we need to work through. And that's part of it, is finding, and like Doug said, I mean, if you think of just about like some pretty well-known internet, sites where you can buy whatever you want, right? These products are typically hemp or other things. And so if CBD hasn't worked for somebody, it's probably for one of two reasons. One is either they haven't gotten CBD at all, or they haven't sufficiently dosed it. And so what we recommend typically is, 25 milligrams to start, and then, titrate it up or titrate it down based on effect. But there is definitely a minimum dose.
Yeah, for someone who has never used CBD before, never used cannabis in any way, starting out even with 25 milligrams may cause them to feel a little gunky. You can get a little upset stomach, your head might ache a little bit. So that's for someone that's totally naive to the whole category. So starting out with 12 milligrams a day, using that for 2 or 3 days, then increasing up to 25. And then, as Jeff said, titrating up even higher if necessary to get the relief that you're looking for. About every 3 or 4 days is the right way to step up to an appropriate therapeutic dose. But there's no maximum.
Now,
So
let me interrupt you real quick. Why would someone feel gunky if taking it at the first? Is it because it's cleaning out your pipes? Like, why would we feel bad?
that's an awesome question. So we, as we talked about before, we have these endocannabinoid receptors, and they've been lonely for a long time, right? They haven't gotten any cannabinoids, and now they get their first dose, and they're like, "Hey, this is great! I love this," and they don't know quite what to do with it, and so that causes some downstream effects in the body. So it's not like you're going to be sick or throwing up or anything. You're just feel a little not right.
Okay. Yeah,
No
I'm
diarrhea, no
familiar with
throwing
that
up.
feeling. Yeah, and
Yeah.
someone like me who is a nerd on like my body and healing and things, I went and had my genetics run against my endocannabinoid system. So I learned that I metabolize CBD like an Olympic champion.
Your rapid metabolizer. There you go. Yeah.
And so one of the things that I learned was, okay, I need to introduce it into my diet multiple times a day and up the dosage. So, I take it right when I wake up in the morning, mid-morning, in the afternoon, before I go to bed. And it took me doing that consistently for 2 weeks plus before I was like, "Okay, I know what CBD is doing for me." Before that, you're like,
Yep.
"I know what the literature says it's doing for me. I know what." But
Yep.
if it's not done consistently, it's really hard to
Yeah.
know.
Well, that's a great comment because it acts like we've talked about with receptors and enzymes and all of these kind of fancy words, right? I mean, it acts in the body like a drug, but most drugs are the same way. They're a lot of them are weight based or other things, and so you do have to find the right dose. But in a lot of cases, we don't push the dose to where it needs to be before we give up on it, and that's unfortunate because CBD can help a lot of people. And so again, I think we have some people coming in to say, I tried this 2 or 3 years ago and it didn't work. So we have to kind of walk through that because again, the high likelihood they weren't getting CBD, they were getting hemp, or they were not taking enough of it, and rightfully so, it wasn't going to work. But these are all, to where you started, these are all questions we should be asking, or patients should be asking is, what is it? What is it good for? How do I take it? What's my dose? All of these, and this is why, again, we think people need to be careful on who they're talking to.
Yeah, definitely. When you go to a website to purchase any sort of hemp, cannabis, CBD products, I always immediately go to the About Us page. I'm like,
Yeah.
are there actual humans that are running this? Who are these people? Where are they from? Where is their farm from? There's just so much out there that you can't trust. And so, looking under the hood before you even go to their products page,
Yeah.
to me, is the fastest way to save
Yeah.
time when you're doing this whole
Good
thing.
point. Yep.
Yeah, that's really smart.
But the one thing that I think a lot of people do is they splurge for the expensive bottle of tincture and, it doesn't last them 30 days, so they're like, well, I spent $180 on this thing and it didn't work. So CBD, this is all a fluke.
Yeah. Yeah, hopefully
So
the price comes down as things get better and everything else. But it is not to be disingenuous, it is expensive, and you do pay for what you get right now, and it can add up. So again, it's important you don't waste it, and hopefully you use it correctly.
So I think that's an important thing to talk about with dosing and how much someone is buying. So buying the most expensive product isn't always the most potent product. So it's really being a careful consumer and looking at the label and asking how many milligrams of CBD are really in the product that I'm buying, and what type of CBD is it? Is it broad spectrum? Is it full spectrum? Can you discern the difference, one versus the other? And if is it just hemp oil, which probably doesn't have a ton of therapeutic effect compared to a broader full spectrum CBD oil. And so being a wise consumer to look at the label and try to discern what they're really selling you is really the first step in getting the right dose.
And that actually is a dovetail and actually part of the question from Jen, another listener. She's saying, is all CBD the same? Meaning, is CBD from one strain going to give me the same benefit as another? And also sun grown versus indoor. And so she's somebody who's into flower. And, and I know a lot of cannabis brands in California who are actually now making their products using strain specific, cultivar specific flower. So, who wants to jump on that one?
I'll start.
Okay.
Did you want to, Jeff?
No, go ahead.
I don't want to.
Yeah,
Okay.
I'm trying to think how I would answer the sun versus the indoor outdoor. I have no idea on that one. I was saying, but go ahead.
Yeah, I don't know about the indoor outdoor either. I know that the science on the cannabis side is indoor versus outdoor. I think the indoor growers are getting really smart about lights and pumping CO2 in and having the right combination of humidity and daylight versus dark hours in order to get good growth. And I know that's easier to control than outside. So I don't know if there's a big difference indoor versus outdoor growth. Strain can have a difference because there's a different level of CBD content, as well as the minor cannabinoids.
Right.
So when Jeff and I talk about CBD, we're not talking about, most of the time, we're not talking about CBD isolate that's just CBD. We're talking about products that have all of the other cleverly named cannabinoids like CBN and CBG and CBC and CBV, and CBV, and then the V versions and the acidic versions of those also. So the strain can certainly have a difference depending on what you're looking for. You're looking for something with a little more CBN or something with more CBG.
Yeah.
And that's the other
so
thing.
that's a good
So
question.
looking for something that says full spectrum gives you a shot at getting all of those trace cannabinoids. But the distillate, the isolate, they are what they say. I mean, an isolate sounds awfully lonely. So
Well, I think it's an interesting, because I think that's where the science is heading. Just in having conversations with our chemist, is that if somebody, CBG might be better for like neuropathic pain than CBD, right? So if that's what you want to treat and use this for, then we should give you CBG and not, a phytocannabinoid rich or full spectrum, right? So I think the science is heading towards targeting some of that to conditions. And the other thing is, what we've also learned is that, where it's growing and how it's growing in the soil. I mean, the plants actually are pretty receptive to herbicides and pesticides and what's in the soil and things like that. So you have to be super careful there about the source and how it's grown, because again, it's not only what's in it, but or what's not in it, but what's in it. You know what I mean? So so that's the other thing is some products have, and ours does, not to plug ours, but just that's the other thing I would ask about is, do you have it like a certificate analysis or a lab test on the product, just so you can be comfortable what's in it and what's not in it.
yeah. And it's really easy to see when you have a, a plethora of terpenes and cannabinoids in something,
Right.
versus looking at a lab test and, it
Knowing what that
says
means. Yeah.
there's only CBD and, there's, non-traceable anything else. And so, yeah, the entourage effect is very real. And I appreciate you guys for giving us the professional nod. I think we all, we all know it in our hearts, but we like to hear somebody else say it out loud.
Oh, there's a huge difference. So isolate slash distillate compared to a full spectrum product that has the minors in it, it is night and day difference in terms of effectiveness, in terms of speed to action, and the result that the user is looking for.
And, when it gets expensive, there is such a thing as growing your own medicine. And, the family, I live on a farm, and the family that is here, the parents, they started growing their own CBD flower and some THC and some 1-to-1. Um, and I just helped them, trim their harvest. And I love it. 70-year-old people making their own medicine. They make their salves and tinctures and oils. And, it's something that we all need a hobby. And
Right.
it's nice to have one that's good for us. So, if the price of CBD is getting a little out of control, become a home grower.
Yeah, why not?
Have y'all ever grown yours?
No.
No.
We're
Well, it's a good,
we're not going.
I wouldn't be casually baked if I didn't ask.
No, we haven't, but we have an amazing chemist who is also a grower, and we know really good growers that we trust, which I think is also an important point. And Jeff started to say it. If someone is growing hemp, industrial hemp, for example, and they don't quite know what they're doing, then their CBD content in that hemp is going to be either too low, or their THC content is going to be too high, and that causes some trouble. Or they're going to have something in there that we simply can't use. Fungus is such a big issue in industrial hemp that you really have to be careful. So we know our limitations. We're not.
So what was the, how did you two come together to create the Farmer and Chemist?
Well,
That's a
Doug and I
good
have known each
question.
other for 20 years. We've worked together in other pharmacy parts of the field, if you will. But so we both live in Utah. A few years ago, there was a state initiative on the legalization of cannabis, and so we were asked as so-called whatever experts to kind of consult with some of the state legislatures on models and like in dispensaries versus pharmacies and a bunch of other like operational things. And as part of that, we learned a lot, but we saw an opportunity with CBD, that there was just this lack of education and wild west and lack of regulation, and there needed to be something out there that was better and more educated. And so we decided a couple of years ago to start the company. And again, our the people we put together to start Farmer and Chemist it was strategic. I mean, we're pharmacists. We have a couple physicians involved, we have a chemist involved, and we have a couple of attorneys involved, because we wanted to make sure we were doing this the right way. So
And a great designer.
Yeah.
You have very clever names for your products, I will say.
Yeah. So it was
Thank
kind
you.
of, we kind of saw a need for some help, and, due to some cannabis initiatives that were happening in our state. And so
Yeah, I think
we opened the store about 2 years ago. We do have one brick and mortar, but we have a pretty good online presence. But our store's in Salt Lake, and it kind of goes in line with what we're talking about. Everybody who works there is either a pharmacist or a pharmacy technician. So we want, everybody to feel comfortable, and it's a nice store. It actually was an old pharmacy from the 1940s.
Oh, that's fun.
So we want, it's really cool. It's old tile and antiques, and, it's bright and everything else. We want, we don't want people feeling like they're, sneaking around, coming into the store.
Yeah.
So.
Yeah, I think we're a little bit unique. Most pharmacists, and Jeff and I are the same. We were trained in traditional medicine, traditional Western medicine. So, chemicals are good for us, and if a little bit is good for you, a lot might be better, or a little bit less might be better. And so our training was really down hardcore science, and we were training with physicians. And yet we're in the CBD space because we recognize the therapeutic benefits and value of cannabinoids. And so it's a little bit of a departure from standard medicine. So there are some pharmacists that are excited about CBD. I think it's sold widely in pharmacies, and so pharmacists are getting up to speed on the products and quality and what they're used for. But it's still a very specific niche, and I'm glad to be in it. It's way more fun than traditional pharmaceutical products,
Yeah,
and the
your
people are
store
way more
looks cooler
enjoyable.
than the CVS.
Yeah, thanks. If we just hit that minimum bar of looking like a sterile pharmacy, we'd feel really sad.
I know, right? So, what would your advice be to other pharmacists who want to learn more, want to become more of an expert um, so they can maneuver back and forth between Western medicine and whole plant options? Where should they start?
Yeah. Well, we started first getting to know people in our community who were already experts, and leaning on the local science and scientists quite a bit. We did a fair amount of online research. We've searched every publicly available um, piece of medical literature, every journal article that talks about cannabinoids and cannabis, and really started to learn the science of the
Yeah.
cannabinoid receptors, the endocannabinoid system, the value of the minor cannabinoids. And it's really just taking the time to learn something new,
Yeah.
um,
Yeah,
So,
like
finding
when, like when,
reputable
is
like when, yeah,
resources.
like when, like real drugs are approved, right? There's studies that are done that have to be submitted to the FDA to get approval for those medications. It's kind of the same thing. There's studies out there, there's data out there. So I would refer people to those trials and do similar searches that they would do for any other medication. Now, again, like we said, the science is catching up. It's not as robust as it is with
Right.
some of these other medications, but it's out there. And again, and I would echo what Doug said, is talk to people who have become more educated in this space.
So now let me ask more of a pointed question. Is there any educational programs out there that are specifically designed now to catch up medical professionals in this? Or is it like, hey, just do your own homework, basically get a degree in CBD, but it's just you doing your own homework and research?
Yeah, there are some continuing education programs for physicians, for pharmacists, for other healthcare professionals that talk about that talk about cannabinoids, mostly cannabis,
Yeah.
not so much CBD.
Yeah.
And so, for example, in our state, physicians who want to prescribe cannabis need to go through a training program. It's pretty short, but they get a little education about it. So there are some professional resources that are available to healthcare professionals that also give them continuing education credit. So that's really great. I think the concern that I have about those is that they're still driven from a Western medicine perspective for the most part, which means that they're not always looking at the complete value of CBD products. And as Jeff said, the science is so young, even though it's been around forever. But the real hardcore clinical trials and randomized controlled trials just aren't happening yet. They're starting to. So most of those CE programs go back to the participant and say, we're just not sure. We're leaning towards believing that it's going to have an effect in this area or this therapeutic concern, but we're not quite sure yet. So,
Well, and that's because I think y'all could attest that everyone's hamstrung by the pharmaceutical industry and the fact that we can't even say the things that CBD does, like the anti-inflammatory, like you can't even say that, but you
Right.
know that that's what it does. So, how do you, as pharmacists, how have y'all kind of maneuvered that around even the language that you use?
We're certainly really careful in our labeling. We comply with the FDA's rules around making claims and our own state rules around making claims. But when we're interacting with a patient and they're asking us questions, we can answer those questions. And that's totally safe because we're basing it on the research that we've done and that it's available. We're not making any claims about cures. We're not saying it's going to work for everybody. So I think we apply the same careful approach and scientific approach to this, just like we do other medicines. An antidepressant, for example, that has been used in tens of thousands of people in randomized controlled trials, and then tried in millions of people worldwide, still may not work for someone because it's all individual.
Yeah.
So we say the same
And
things
this
to patients.
has a lot to do with it.
That
Well,
has a
no,
lot
no
to do
drugs
with it.
work. No drugs work 100% of the time. So
Yeah.
Yeah.
So I tell people, when I'm describing, the different cannabinoids, I call CBD the scrubbing bubbles of our endocannabinoid system. And so that
I
they can
like
go
that.
through and clean everything up, flush it out, get it all sparkly and new. So, a lot of people, they'll take a month off from drinking, or, now the new thing in the cannabis community, people giving themselves a reset and, laying off of the cannabis to reset their endocannabinoid system. And I don't do that. I just take a lot more CBD. So, in your
okay.
professional opinion, is like doing a CBD flush just as good as stopping consuming cannabis for a month?
That's a great question. I don't know. I've never had this question before.
Yeah.
So this
You're
is my
welcome.
Yeah.
yeah.
I don't have a good answer for that either. I've never kind of heard of the cleanse, if you will, the CBD cleanse or scrubbing bubbles or anything. So that,
But
yeah, I'm going to go check it out.
I like the concept of, so there are a lot of other categories of medication where we take medication vacations or holidays. And it does allow the body to downregulate, and then the reintroduction can be really effective to make something better for the patient down the road. So I think there's probably some valid science behind it. I don't know with CBD, frankly, if it makes a lot of difference. If someone took a CBD holiday, would they come back to it and would it work better? I kind of doubt it.
No, I meant taking a THC
Oh,
holiday by,
Oh,
like,
okay.
using
using
CBD.
just CBD.
Mhm.
Yeah, I think that makes sense in terms of downregulating especially the CB1 receptors in the central nervous system that are tremendously responsive to THC. So I think that there's probably some valid science behind a THC holiday or vacation.
That
All right.
intuitively makes a little bit more sense. Yes. Yeah.
Yes, of course, I wouldn't recommend it over the holidays when you're with your families.
Yeah,
I need to dose up.
not the time to mess around and experiment.
Oh, goodness. Well, gentlemen, is there anything that I didn't ask you that you think's important for us to know about, CBD and making smart decisions around it?
I think we
Hey,
covered it. We talked
yeah.
about knowing where you're buying it. We talked about potency, metabolism, and how fast metabolizers need to use either more or more frequently dosed product. We talked about drug interactions and safety. Um, I
Yeah.
think,
Ask. If you have questions, ask.
right.
Now, where
Yeah.
can people find your products?
So our website is farmerandchemist.com. And again, we have a storefront in Salt Lake City, right in the middle of the valley, but anybody can go online and check us out. And we have a wide range of products, topicals, and then other ingestibles from the tinctures to gummies to, all of the typical. So pretty cool. And Doug alluded to this, pretty cool packaging and naming and things like that. So we're pretty proud of the product, actually.
Right on. Well, I appreciate you guys being here and for sharing your wisdom and your time with us. And our only comment was that it was a great interview.
We'll
We're
take
flattered.
it.
That's really
We
cool.
will take it. Yeah.
It's been awesome to be with you. Thank you very much.
Yeah, we appreciate it.
Thank you. And thank y'all for hanging out. We'll catch y'all on another podcast soon.
It's high time. We had a high time together. Yes, there's a high